So, hello everybody. I'm totally thankful for everybody's presence here because I have come to realize that group energy has a very profound meaning. And together we can do things that alone we cannot. Today's topic is chronic pain. And I'm just going to start sharing my slides. And chronic pain, by definition, means any pain that lasts longer than 3 months. Today, those of you who have come to my talks, you know, my talks are a little bit different from classic talks. Oftentimes in these talks, our purpose is paradigm shift, finding a new vision, looking at things differently. Today, when I'm talking about chronic pain, I'm going to include mental pain as well, mental pain and physical pain. Lasting for longer than 3 months is labeled as chronic pain, and it is completely different from acute pain. Acute pain happens, let's say we break a bone, we traumatize a part of our body. So there is a major difference between acute pain and chronic pain. For example, one of the chronic pains that a lot of people suffer from is fibromyalgia. It's a muscular pain, and it involves many points of the body. They are called trigger points, and it's a muscle or tendon pain, and it has a very interesting pathophysiology. We're going to address some of it in the future slides. The reason I have put this iceberg here, I want to say that when we talk about pain, only the part that is out of water is the pain. And these days, there is no question and doubt about the fact that pain is a memory, especially chronic pain. Not acute pain, but chronic pain is a memory. So it's not even in our physical body, it's in our brain, it's in our mind. And this iceberg exemplifies a person who is basically alert, aware, and is not comatose, or is not even absent-minded. Even in that kind of a person, the pain is only the part of the iceberg that is out of water. There are layers and layers and layers of issues underneath that contributes to the continuation of this pain. Unfortunately, modern medicine doesn't look at these things at all. Comes and only looks at this and does certain things, but patients do not get better. Now, my journey in the past 10 years has been finding unity in the mind, body, and soul. The representative of soul in our body, according to yogis, and I do yoga, is our breath. And I learned this statement from my yoga instructor, not in medical school, that when our mind and body and breath go together, we integrate. When each one goes one way, which in this modern society with multitasking and doing 10 things all at the same time, our mind is one way, body is somewhere else, and breath is shallow. Then we disintegrate. This disintegration leads to all kinds of chronic illnesses one being chronic pain syndrome. So union of mind, body, and breath or spirit or soul is an amazing thing that we need to aim for. And another analogy for this iceberg, this is the example of one of the most conscious layman or person from general population, that their conscious mind is only, let's say, 20% at most. The rest is pre-conscious mind or unconscious mind. And 90% of, or more, 95% of our thoughts that leads to our beliefs and behavior and our being comes from our subconscious mind, and at best from our preconscious mind. So here is the significance and enormity of the issue that modern medicine right now cannot deal with chronic pain syndrome. And the sad news is that out of 330 million people who live in United States of America, 1 out of 3 has chronic pain syndrome. So it's a really, really, really serious matter. Briefly, I would like to mention what health is. Health means lack of pain, lack of discomfort, because disease means dis-ease. Dis-ease. Multiply dis-ease by 5, 10, 20 years, it becomes disease. In medical terminology, balance and harmony is called homeostasis. Harmony. In harmony and balance, our body is in a good shape. The balance between mind and body, the balance between the construction and destruction, and the balance between the 4 fundamental systems of the body: psyche, nervous system, endocrine system, and immune system. Psycho, neuro, endo, immune system. Functional medicine really, really focuses on these, because in my talks, I always say that this is like the 4 wheels of one car. If one goes out of balance, all other 3 are going to get affected. Psycho, neuro, endo, immune. Immune system we are all aware of, especially after COVID era. Endocrine means hormonal system. Psyche is our psyche, and nervous system are the branches of nerves that is all over our body, and they're different forms and shapes. Now, we talked about balance and harmony. I think it's extremely important to understand that our balance and harmony is our personal responsibility. To a point that we become internally so bulletproof that we go through life with balance and grace from moment to moment to moment. How do we make that happen? 8 dimensions of well-being are the 8 dimensions of our life. We need to stay in balance physically, socially, occupationally, emotionally, financially, environmentally, spiritually, and intellectually. These are really important. And in this time and era, with everything that is happening outside us, I'm not going to claim that it is easy, but it is possible. Little by little, by increasing our awareness and strength, internal strength, it is possible. But why isn't it easy? Very, very simple. We eat toxic foods, we have toxic thoughts, we have toxic cultures, and we have toxic environment. So it sort of appears like we're swimming against the stream. Therefore, we need more and more and more of platinum life. At the end of my talk, I will mention what I mean by platinum life. Yes, after all of these things that we talked about, it's impossible not to get confused. It's impossible not to have chaotic mind. And as soon as we have chaotic mind, we're going to have chaotic body. And we're opening the door for all kinds of aches, pains, and illnesses and diseases. But let's go to basic. If we want to build a strong, powerful high-rise and building, we need to have profoundly good foundation. The foundation of our health is proper nutrition, proper exercise, proper sleep, and proper stress management. Stress is going to be there. We just need to manage the stress. When it comes to stress management, there are millions of different approaches and ways, but I'm going to just mention two little things because it's important. One is perception. Each different person has a different perception. For example, we all have heard about the glass half empty, half full. This glass is half full, half empty. Person A is an optimistic person, sees it more full than empty. Person B is a pessimistic person, sees more empty than full. All right, they can manage somehow. This person is going to live happily, sometimes is going to be happy-go-lucky. This person is going to struggle. There are two other scenarios. Here, person A sees the glass that is half empty, half full, completely full. This person, in my opinion, is illusional, will miss a lot of issues in life that are dangers and risks, but will not see them. And the other scenario is person B, looking at the half full, half empty glass, sees all empty. This is bad too. It's even worse than the first scenario, second scenario. In this person B is in despair, is a hopeless, negative person. So our perspective plays a fundamental role in stress management. Ginger, I'm sorry, these are written in Farsi, but I'm going to translate them for you. The other thing that leads is very, very, very important in stress management is the anatomy of upset. Why do we become upset? Because chronic upset leads to major issues, including chronic pain. If we think that upset is a pie and we cut it into three main slices, one big main slice that leads to upset is unrealistic expectations. Looking at a cat, wishing that was a dog. The other third of this slice is undeclared communication, the things that we hold inside and they all turn into toxins, the things that we needed to communicate with our spouse, with our child, with our friend, with our neighbor, with our colleague, we hold it in, leads to upset. And the last big slice is thwarted missions. You have a plan in life, you have worked hard for it, like you've sat and studied for a board exam for a year. On the way to the board exam, you have a major accident and you have a broken bone. That can lead to upset. Now, I would like to mention the importance of the connection of the brain to our guts. These days, a lot of people are starting to believe that our guts are the ignored organs, and they're actually the first brain. and this one is the second brain. That's why they say gut feeling. Now, why do I harp on this? Why do I say guts are so important? Because inside our guts, there are tons and tons of bacteria that are there, and they should be there, and it's called microbiome. And 85% of these bacteria are supposed to be helpful and good bacteria. Only 15% are bad bacteria. We have these microbiome everywhere, on our skin, inside our mouth, and everywhere else in our body that are in touch with outside body. Now, whatever is happening in our brain, it also is happening in our guts. Therefore, now I'm going to start focusing on microbiome. This tree is our body, mind, and spirit. The glorification and health of this tree. Now, the new science is really going to confirm this. Literatures are going to come, but not now, maybe 10 years down the road. NIH has a department that they're researching microbiome, but I have been aware of this for the past 8 years. To certain literatures that I study, microbiome is going to be the future of medicine. Why is that? Because we have 30 to 50 trillion cells, and they have DNA. Microbiome also has DNA, but the weight of the DNA of the microbiome is heavier than our total DNA. Therefore, by altering the DNA of the microbiome, we can change our DNA. And that is called epigenetics, beyond the traditional old genetics, that we are not the victim of our old or parental genes. We can alter them. Now, it even goes to since birth. Our microbiome starts action since the moment the baby cries, the first cry. These days, they say that baby is born to C-section, has lower immunity because they don't pass through the birth canal. They don't eat some of those secretions and all that, and their microbiome is weaker. Some people are coming with the theories that when kids they come to this world through C-section, some of those secretions to be fed to them to have better microbiome. And if our DNA is our destiny, so microbiome is our destiny, because with changing our microbiome, which is a bacteria, alterable with food and alterable with thoughts, we can change our destiny. This is the microbiome under the microscope, good and bad bacteria in the guts. And there is a commercial test called Viome. No insurance company covers this. You can buy it online and have your sample, stool sample, tested. It takes 4 or 5 weeks for them to get back to you and tell you what your microbiome is like. It used to be like $400 or so. Now more people are using it, and the price has come down to around $200 or so. Viome, V-I-O-M-E, is a test. Now, I talked about the fact that this bacteria inside our body are affected by our beliefs. Our beliefs are affected by our thoughts, and our thoughts and beliefs and our behavior and our being affects these bacteria's behavior. And this is inside our body, but outside our body, bacteria and viruses being affected by our behavior. The classic example was COVID. The more fearful people became, the more COVID mutated and changed shapes and forms. Pretty soon we're going to get to fear and understand that root of all pains and disease is basically all the negative feelings, including fear. So this is a slide that is cartoonish, but is altering the DNA, and I believe in it. This is a damaged DNA, and the reason our DNA gets damaged is because of free radicals. Free radicals, I had to talk about it at one time. It's a lengthy discussion, but we'll just learn the name here. Free radicals increase the oxidative stress or oxidative load of the body. And when this happens, our normal cell with increased free radicals becomes like this. And when the oxidative load goes higher and higher, our cells becomes like this. How could this cell function properly? Will not. Will cause all kinds of issues, including pain. And this again is schematically like a healthy tomato, a tomato that analogy of the cell that is attacked by free radicals, and this is a tomato that is loaded with oxidative stress. And our cells oftentimes can become like this. Normally, some of the cells are underlined to become like this, like our skin cell dies, but fresh new cell comes out and replaces the dead cells. Now, when we talk about DNA, DNA is part of the chromosome, and this is a chromosome of a young, healthy person. I just wanted to introduce a part of the chromosome to you guys that is called telomere, this red part. When we have a thick, robust, dense telomere, our cells are healthy. In sick and old people have old cells. In sick and old people, the telomere is thin, small, and affected and atrophied and very small. And the analogy that I usually give to people for better understanding of integrity of the telomere is the shoelace. This end of the shoelace has this metal part, and this part of the shoelace remains intact. This is the young and healthy chromosome. But when here, the end is defective and it's fallen, just like the small telomere, the shoelace starts fraying and becomes frayed. And we get off balance. Our health is gone. When we have sick, abnormal DNA, our cells all get affected, But how come one person gets asthma, somebody gets migraine, somebody gets something else? Is because of other issues, that somebody's lungs are the weakest part of that body, somebody's heart is the weakest part of that person, or his skin is the weakest part. So it's a general health issue that in different people manifest in different parts of their body and different organs. But one thing that I wanted to bring to everybody's attention, all these chronic illnesses that we have a lot of examples up here, takes years and years for them to declare themselves. The work to be done called prevention that I have been addressing in the past 7-8 years can be done in this part since birth to like early ages. And these people, if they eat wrong, they don't sleep, they don't exercise, because their cells are young, those cells cope with all these toxins, but then it gets to a point that cannot cope, and this curve goes rapidly high, and then this is when we are ill, and then we need to put lots of chemistry in our system and try to cover up the symptoms, or Band-Aid treatment, we call it. This is another analogy of it takes a long time for illnesses to evolve. The person who have fibromyalgia was not born with it, doesn't get it usually in ages before 20, but then boom, starts escalating. And involves every part of the body. In somebody, presents itself in the form of Alzheimer's, memory loss. In somebody, blurred vision, acid reflux, increased risk of breast cancer, back pain, irritable bowel syndrome, increased risk of colon cancer, arthritis, like degenerative arthritis, or even inflammatory arthritis, low testosterone in men, unexpected weight gain, and central nervous system disorders. So it can basically involve the body from the top of the head to the tip of the toe in different people in different parts of the body. So traditional treatment means pill after pill after pill after pill after pill. We give one pill, it causes some complications, we add another one, another one, another one. Honest to God, I'm not going to address this today because we're talking about paradigm shift. We're talking about vision change. So I would like to mention the role of the stress in the creation of illnesses. This is a stress curve. The best place to be is this rectangle of the yellow zone. Here we have healthy stress, motivation, and we achieve our goals. In green part, it's a very inactive life, laid back. Not everybody can afford to do this. There is a percentage that they can potentially do this, or maybe healthy retired people. Most of the retired people fall in here, unfortunately, but healthy retireds can live this life. So we really need to watch ourselves from moment to moment to moment to stay in this healthy zone of the stress curve. As soon as we go up and we get to fatigue, if we don't watch ourselves and track back, we're going to fall into the curve of exhaustion. And when we get here, diseases are coming. And if we are not careful and ignore our pain, I always say pain, either mental or physical, is like smoke detector. When there is a smoke detector sounding, it means do something. It doesn't mean that ignore it. So pain is a smoke detector of the body, means do something different from what you're doing. And if we ignore our body's smoke detector and push through all these pain, struggle, agony, and toxic food, toxic everything, we're going to fall in the red zone. In the red zone, healing and cure becomes extremely difficult, and we need to fill our body with pills. Another analogy that I had here is our path. Which path do we want to follow? Do we want to be a fearful person who is not a loving person and is always waiting to be loved? Are we kind of people who is resisting everything and complaining all the time? Are we confused and we are idealistic and illusional? Are we disconnected from people? Are we nervous all the time? This is path, red zone. It goes down. It's down a spiraling path. What is paradigm shift? Come up here with courage, willingness, with love, which starts with self-love, acceptance and letting go, being realistic, not illusional, not in despair, getting connected, being peaceful, and up spiraling. This is possible. This is health zone. This is illness zone. This slide is a bit hazy. I apologize. I made it myself a long time ago. In every moment, whatever we're doing, it's very honest to ask ourselves, why am I doing what I am doing? Is it fear and need-based? Or is it choice and love-based? If we are here, we're going to create good results. I framed it with green. If we are in fear and need zone, we're going to not lead a good life. It's going to be difficult. It's going to be all struggle and survival. If we make the shift to choice and love, it's going to be joyful and living and thriving and flourishing. And it is possible. We need to deal with our emotions. We really need to be in touch with our emotions. And here, going back to the foundation of our health and the tree being a representative of us, mind, body, and spirit combination, is the agreement of the heart and the mind for the heart to have a leading role, for us to go everywhere with an open, loving heart, but take our wisdom, good wisdom with ourselves as well. And the hope of the future is neuroplasticity, means by doing the right things, we can rewire our brain. Unless if you're really traumatized badly, those might be exceptions. All right, what am I recommending? Non-chemical, no pills, those are last resort. Surgery, last resort, go for it. But I am in the domain of natural treatment and prevention. Breath, breath, breath. Last topic was natural breath therapy. We talked for an hour about all of the ways of breathing and how breath is the most effective detoxifier of the body and is for free. Yoga saved my life. Yoga. Meditation is amazing. I had a talk titled Meditation as Medication. I believe in it. Juicing, part of detoxifying. Organic, green, colorful fruit and vegetables, mostly vegetables, local, and rainbow colors. The ones that are colorful have had better exposure to sun, and some changes has happened in them that are better for our health. For example, 8 daily detox tips. Drink lemon water every morning on empty stomach. Oil pulling. This is a very nice thing for teeth. A little bit of coconut oil, pure coconut oil. Hold it in your mouth for 3 to 20 minutes every morning. Honest to God, it helps the health of the gums tremendously, detoxifies the mouth, and our mouth can be the origin of a lot of illnesses. That's the second tip. These are just only 8 examples. Drink fruit-infused water throughout the day. Drink herbal teas throughout the day. Eat whole food rich in fiber and antioxidants. Antioxidants neutralizes the free radicals. And keep moving and sweat, because sweat is another way of detoxifying the body. Go in the nature and connect to outdoor and take some detoxifying baths, or foot baths are also with ionizing machines can help for us to detox ourselves. I have started believing in alkaline water. Alkaline water is good for the body, Kenyan water, but there are many, many commercial ones available. One has to be extremely careful in selecting the alkalinization of one's water at home. Proper sleep, exercise, connection, changing me to we. Me becomes we. It's a foundation of health. Acupuncture, tapping. I've had single sessions for each one of these. And Maslow's triangle, most of us might be familiar with our needs. In one book I came across, in The Dark Side of Light Chasers, Debbie Ford mentioned that Before even our physiological needs, us human beings have a fundamental need of feeling worthy and belonging. These are important things. If we go into the root of somebody who has fibromyalgia, God knows what things are happening in the subconscious. And the smallest event in the childhood can make us not feel worthy and or feel alone, feel as someone that has difficulty connecting. Let's simplify our life. It helps tremendously. Donate, 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 and keep only what we need. Stay in now. Power of Now is a book that is priceless. The more we stay in now, we become mindful. Stop labeling yourself with illnesses. I have migraine. If we keep saying I have migraine, even if we don't have migraine, we will manifest it. I do remember myself, I'm getting some messages here and click, sorry for this additional noise. I'm a chronic pain patient myself, and I've recovered 80%. I remember I was talking to a coach online and I said, I'm determined to be pain-free in 2 years and not take any pills. I said, don't even mention this word pain. Anytime you say pain, your subconscious hears the pain and the memory of the pain becomes darker and thicker. Say, I'm good and I'm going to get better. This slide says that. Don't label yourself. I'm a migrainer, I'm a migraine sufferer. Throw all of these things in trash can. Have a mantra. I'm good, I'm getting better. A few new things. These are new age stuff. I absolutely am not familiar with these, but in our meditation group, there's a gentleman who is in Saskatchewan in Canada. He swears at this machine. This is a machine that changes your body by alteration of your frequency, and you don't need to even wear this. Like in traditional medicine, we have tens units that patients wear. This is way, 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 way more sophisticated than that. It's a LET Health company that has produced these, and because not many people are buying and using it, are extremely pricey, $7,000, $9,000. This gentleman had one that was $2,000 worth, and he upgraded himself to the 7,000, and he swears at it. And he gave the 2,000 to a friend, and I talked to him yesterday actually to get this information. I texted him. He said, my cousin sprained her ankle, used it, the next day was totally pain-free. It's by frequency, and I have started believing in frequency. Another new age thing is Life Wave. Life Wave are patches. These are not commercial at all. And then if you want to purchase these, we have to be extremely careful not to buy it from irreputable places. Life Wave is a patch that when you wear it, it increases the motion of the energy in your cells. It is basically like you have stem cells from outside implanted on your body and generates life. It's a kind of phototherapy. It's interesting. It comes in X39 and X49 patches. At the end, I'm going to leave 15 minutes for questions and answers. I want to introduce a few books. Letting Go by Dr. David Hawkins. I have fallen in love with this gentleman. He has written several books. Map of Consciousness is his work. Through kinesiology and recording the frequencies, he has mapped consciousness, which is fascinating. This is his book of Letting Go. Anybody who has chronic pain, I do recommend to read this book. Another book that I myself started reading just a few days ago, End Chronic Disease. I strongly recommend this book. This is a lady who was a nutritionist, I believe, or she became a nutritionist. She had back surgery and then got paralyzed, went into despair, and they wanted to suggest fusion and whatnot. And she started feeling like, why did my body fail me? Then she came to realize that her body did not fail her. She failed her body. And she emphasizes a lot on microbiome, and it's a book worth reading. So the goal of today was for us to use different methodologies not to become this. And I would like to suggest all of us a platinum life. Platinum life, P stands for peace, L stands for love, A stands for awareness, T stands for trust, I stands for integrity, N stands for neutrality, U stand for unity, usness, not me, usness, creating win-win situation, and M stands for mindfulness. And I would like to thank Pars Place or Iranian-American Community Center for giving me this space to be able to communicate with you what I have learned in the past 7 to 8 years. And I thank you all for being here. I am going to stop the slides. And now I'm open